And let's be honest right now. We're facing significant challenges to healthcare right across the country. Access to family doctors and nurse practitioners is not what it needs to be.
If you or a loved one have navigated the health system lately, that might be considered an understatement. Long waits, big frustration, a crisis in care. Tonight, a new lifeline. Good evening. Is money aimed at easing the strain for a system on the brink?
An agreement between the provincial and federal governments worth billions. CTV's Queen's Park Bureau Chief Siobhan Morris reports.
They're the next generation of nurses, badly needed on the front line of the healthcare system.
And let's be honest right now. We're facing significant challenges to healthcare right across the country.
With long wait times in hospital emergency rooms, difficulty pinning down a primary care physician, the federal and provincial governments have agreed on a $3.1 billion package to help.
Increase access to primary care, reduce wait times for surgeries and for seeing specialists, hire more healthcare workers, ensure people have access to the mental health care they need, and improve healthcare for Indigenous peoples.
This deal has been in the works for about a year. 700 spots in medical programs are being added, a tenth of them earmarked for the North. It may take a while for the cash to translate to shorter lines in hospital. The Premier says emergency rooms need more doctors, but that a quarter of patients should be looking for care elsewhere.
Someone might come in with need some stitches or a sore throat, and I've heard these stories. But it's our job to make sure that they get the support they need.
As part of this deal, Ontario has already announced an expansion of family health teams to fill that primary care gap. And there's a commitment here to modernizing record keeping and communication, the end of the fax machine in hospitals era. We're in the patient's room. Federal money is also expected to help accredit healthcare workers who've trained outside Canada.
The PM's going there. I'm not going there.
The health minister concedes there's lots of work to do on this front.
As internationally educated and trained clinicians move to Ontario, move to Canada, that we remove the barriers for permanent residency so that they can start practicing quickly.
Healthcare workers welcome this cash infusion.
Is it enough? It will never be enough. Is it a good beginning? Is it a step in the right direction? Absolutely it is.